Hey guys, and welcome back to XL Medical Spa. My name is Khan. I am one of the providers here, and today let's discuss some body treatments. We commonly focus on the neck and really the face up because that's what's outgoing. That's what people see us every single day, and that's how we see ourselves every day in the mirror, in Zoom, and things like that. But one of the most difficult places to treat is what I consider the body. So the body I consider from the chin down. So the neck is a common focus, but the same way and the same causes that we see in our neck are the same things we see in our body. So how do we treat laxity in the body and maybe some other things that we see on the body as well when we return? So what are the issues we commonly see on the body? Whether it's the arm, the chest, the leg, the stomach, or even the neck, what I consider the body. So what happens is we get laxity. We don't generally lose a lot of volume, although we lose a little bit of volume when we lose fat in general. But when we lose volume in the face, cheeks, the lips, everything around the jawline, the skin settles. So you can imagine when skin settles on our body, it sits on areas where it's weight bearing. So if you look at the back of the arms, skin begins to settle on the elbows. When you look at the stomach, skin starts to settle above the belly button and above our waistline. And then on the knees, skin settle right above the knees and you get laxity right above the knees. And on the back of the thighs, you get laxity as well. So how do we get this laxity and then how do we treat it? You guys have heard me talk about collagen over and over. I stress collagen, and then also it's very difficult to treat as well. So with volume loss in the face, you can just put in a bunch of fillers and create that volume. However, once you get to a certain age, your skin becomes very, very thin, increased laxity, and then everything just falls. So what collagen is the common analogy that we use is it's like the glue that holds the skin together. Or when I see my male patients, I tell them, hey, think of rebarb inside concrete. So concrete by itself is very brittle. So what construction guys do is they put those metal rebarb lattices inside of it to create structure. So what collagen is all these little threads throughout our entire skin. And as long as we're young, we're fit, we're healthy, and we're staying out of the sun, that netting is very taut. As we age, as environmental factors, as diet plays a role, this firm netting begins to loosen. We produce less collagen, and collagen degrades faster than what we can produce it. So now you have a skin netting that looks like this, and you can see how loose it is. So rather than being nice, firm, and taut, it becomes loose. So when you lose that firmness, gravity takes over, excess skin happens, and everything begins to fall and settle. So now that we know the cause, what you'll see is women get laxity on their chests, men and women get laxity behind their arms, and women get laxity on their legs. Now, men get this as well, but women, because of hormones and also because of menopause, go through their collagen a lot more. So when I speak about treatments, usually it's with women just because I do more women body treatments, but it can happen to men as well. So the end goal, no matter what we're choosing the apparatuses or what we're choosing injectables, whatever the treatment is, in the end, we're trying to lift, and more importantly, we're trying to improve collagen. How do we produce more collagen? So in a medical spa treatment and in a surgical treatment, these are the comparisons that I talk about. In surgery, you can cut, you can lift, and you can remove excess skin. So stomach, for example, your stomach becomes lax, everything settles, everything falls. So what they do is a tummy tuck, and again, I'm not a surgeon, so this is my interpretation of it, is they cut away the excess skin, and then they tuck everything back in place. In a non-surgical setting, in a medical spa setting, we can't cut, or kind of, but we can't remove excess skin. So it's not like we can pull the arm up and then just remove excess skin. We can't just tuck the tummy away and cut away excess skin. So what we're trying to do is just throw as many tools at it as possible to lift the area and then improve collagen. So how do we improve collagen? We've talked about previously, you have injectables such as Belafil, such as Sculptra, such as Radiesse, and I'll link a description to previous conversations about collagen and injectable collagens. And then now you also have other collagen stimulating things such as PDO Threads we talked about. And then there's also other types of threads such as PCL and PLLA. But for the body treatments, my go-to treatment is typically anything that's going to mechanically lift the area and then also improve collagen. Now lastly, you can do lasers as well. Lasers such as Ultherapy, ThermiTight, ThermiSmooth, and any number of radio frequency devices as well will also improve collagen and help lift and tighten. Now, optimally, I love to combine treatments together. So typically what I like to do is do a collagen stimulating laser, such as Ultherapy, such as ThermiTight or radio frequency. Because we know after you're done with your final treatment, your peak results are around 3 to 6 months, because after you do the skin tightening laser, your body takes time for itself to induce collagen growth. So that's why your results aren't immediate. Now, in the meantime, after you do the laser skin tightening, my treatment is PDO Threads. You guys know I love using PDO Threads just because of all the benefits of it, and also the reduction of side effects as well. So with PDO Threads, what I'm trying to do is lift the skin or approximate skin, and then also long-term, I'm trying to improve collagen. So if we take, for example, my stomach, let's just assume I had a kid, and then after the baby, I had stretch marks, I had skin laxity, and then also the skin just hasn't rebounded. And then because I breastfed, I lost the baby weight, whatever the case is, the skin doesn't rebound and suck back up as much as possible. So what happens is you get these lines across the stomach, and then you also get the laxity that sits right above the belly button. And I'll pull up some pictures to represent this. But with PDO Threads, what we can actually do is physically lift the skin up with the barbs, and then we take our smooths and our twists to really blanket that area to produce good collagen over the next 3 to 6 months. So the barbs itself do the physical lifting. If you remember, the best way you can represent this is take one finger and lift areas of skin with one finger, trying not to create too much mounding of skin. So if you have to lift the body up so much that you create a mound of skin, I'll represent. So if you're lifting, and you see a huge mound of skin here, you're lifting too much, and that's not what PDO Threads can do for you. If you have that much excess skin, then surgery is your only best bet. Now, if you can give yourself a one finger nudge and it makes you happy in regards to what you're trying to see, then PDO Threads is a great option, and that's what the barbs do. Now, going back to the example of the stomach, what we do is we take the twists and we lay them right in those horizontal lines, and you can represent the horizontal lines by bending over, creating those wrinkles, and you can see where we put the twist. And then lastly, after that, I blanket the whole stomach area with a bunch of smooths, between 1.5 and 2.5 inch smooths. We're just trying to cover that whole area so we can represent the rebarb inside concrete, or we can represent the glue that keeps our skin together. We're trying to tighten that collagen netting back up. So what happens after the treatment? I always talk about the post-care, and I'll link a description below in regards to how we take care of PDO Threads, especially for the body. The body is a lot more strict compared to the face and neck. But what I like to do is I like to bring you back in about 3 months, because that's the halfway point. We know you're gonna keep on improving all the way up to the 6-month mark, but with the body, we have to build that collagen. We have to constantly build it. So much like if you go to the gym, you don't go to the gym once and create the most perfect body that you've ever imagined. You have to constantly go to the gym every single day to build muscle. Collagen is the same way. It's not a one and done treatment. Also depending on your age group. But what happens is you do it once, that collagen begins to grow. I wanna see you in 3 months, because at 3 months, we can dial it in a little bit better. Whether it's the stomach, whether the legs, you come back and we take a look together. We take before and after pictures, and we can decide this area is looking good. This area could use some improvement. So that area that we discuss and look together that could use some little more lifting or even collagen, we'll throw in some more threads at that point. Now, one of the biggest points I want to mention, and no matter how many times I say this, no matter how many times I educate the client, we have the same conversation. So it's nothing new to me, it's nothing new to the practice. But what happens is, because we look at our body every single day, and also because we are our harshest critic, no matter how much I improve the body, the stomach, the legs, the thighs, I will get constant emails, and we'll go back and forth, because you always tell me over and over, Con, there's no results. Con, I spent all this money, I'm seeing nothing. And I just say, hey, hold off, come see me in 3 months. I get it, it's hard. We look at ourselves every day, and we're gonna be super critical of ourselves. But in 3 months, what happens is you've given that time to collagen to grow. Now, when you come back and we take those post pictures, that last visual you had of yourself was 3 months ago. Now we have brand new pictures to compare. And with those before and after pictures, without fail, every single time the client finally sees the results. And that's why those pictures are there. One, so you can see the improvement you've gained, and now we can stack the improvement even more by throwing in some more PDO Threads, or we can discuss other treatments such as injectables, Sculptra, Bellafill, etc., whatever the case is. But that follow-up is so important, because I want to make sure that you see the results. So rather than you just straining yourself every single day saying, man, I'm not seeing the results, that's what it's for. So you can see that positive gain, and now we can stack more gain on top of it. So after those 3 months, what happens now? Lastly, I have you come in at the 6-month mark. So sometimes we'll throw in threads at 3 months, sometimes not, we'll just leave it alone. But at 6 months, this is your optimal gain. If we didn't throw any more threads, we'll take pictures again, do that follow-up, and probably a majority of the time, I leave it alone from there. And then we don't do any more treatments within that same area within the year. Usually around a year and a half, you'll come back and then we'll do a full treatment again. We're really just trying to compound that treatment. So lastly, the question is, how long do my results last? Once you build collagen, whether it's with injectables, lasers, or any other method, you hold on to that based on your aging process. So 1, depending on your age, and then 2, how you take care of your body. So if you're higher in age, you're likely not producing any more collagen. So whatever you've gained, you're just gonna hold on to until your aging process takes back over. The second part of that is your diet. Do you smoke? Are you a sunbather? All those will destroy collagen as well. But on average, if we are happy with the results that you get, typically you're not treating it again within a year and a half. And that is body treatment, guys. It's a quick conversation, but the key takeaway I want from this is collagen. No matter what the case is, we need to build that collagen to make your skin firmer, tighter, to be able to lift that area. So no matter what mechanism you choose, in the end, you're just trying to build collagen. The difference with surgery is surgery can cut and it can take away excess skin. Whereas a medical spa setting, we can't take away excess skin. So there is a limit on the improvement that you get. And that limit, I usually try to represent with 1 finger. If you can lift your body part with 1 finger without creating a huge amount of skin at the top, then we can definitely show you improvement in a medical spa setting. Now, if that doesn't get you to your improvement level, then likely I'll just send you to a surgery consult. You can get the surgery side of it, and at that point you can make an educated decision in regards to whether you want to go the medical spa route or whether you want to go the surgical route. So that is a wrap, guys, for another episode of XO Medical Spa, another educational piece. I want to try to do something every single time. Of course, PDO Threads is always the most popular item that we do here, but then I want to discuss other areas that you can use it, and then also the body area is what we discussed today. The body is very difficult to treat, and it's always a long-term commitment to make sure we build that treatment for you. So if you enjoyed these educational pieces, remember, subscribe to our channel, and then definitely give it a thumbs up. So what the thumbs up does is, 1, sends the algorithm to you. So if you like these videos, YouTube will send you more videos of what you like. And the second part is, if you find these videos educational, then that thumbs up helps push this video to other people who find it educational themselves. So in the end, what we're trying to do is just build educational pieces. So when you come to either our practice or another practice, you are better educated for your treatments. So happy 2022. It's still January here. So I'm wishing everyone a happy new year and a fabulous continuation of the year. Talk to you guys later. Bye.